Are you getting ready to turn 65 this year and interested in learning more about Medicare Parts A and B? There's so many things to take into consideration, such as the choice to possibly defer Medicare Part B or choosing between a Medicare Supplement plan or Medicare Advantage plan. Hi, my name is Sarah, and I'm here today with iHealthBrokers to discuss the ins and outs of Medicare Parts A and B, also known as Original Medicare. Medicare Parts A and B can actually be pretty simple to enroll in. For a lot of people, it's even automatic. However, for many, there are still unanswered questions. Questions such as, what exactly does Medicare Parts A and B cover? And possibly more importantly, what doesn't it cover? Am I eligible? And if so, how and when do I enroll? We'll cover all these questions and possibly a few more in today's video. Now, Medicare does offer excellent coverage, but there are some gaps, which is why many people look to a Medicare Supplement plan or Medicare Advantage or Medicare Part D, and we'll cover those in other videos. If you have any questions, you can reach us at 888-410-0344. At iHealthBrokers, we are licensed brokers, which means we work for you. We're licensed in 50 states and with over 200 carriers, so no matter what your question and where you are, we can help. Anyway, let's get started with Medicare Part A. Medicare Part A is your hospital insurance. It helps to cover things like inpatient procedures at a hospital, nursing facility care, nursing home care, home health care, and hospice care. Now, I say it helps to cover because Medicare covers about 80% of those costs, leaving you with 20%. But with surgical procedures ranging in the tens of thousands of dollars, those out-of-pocket costs can be quite hefty. And that's why a lot of people look at Medicare Supplement plans or Medicare Advantage. The good news is that for most people, Medicare Part A comes with no monthly premiums. There are a few exceptions, but most likely if you or your spouse has been in the workforce for a reasonable amount of time, Medicare Part A will have no monthly premiums. We'll discuss exactly what that criteria is momentarily. You can consider Medicare Part B to be your outpatient insurance. It helps to cover things deemed medically necessary and preventative services. Things like doctor's visits, mental health care, ambulance services, outpatient surgery, and limited prescription drug coverage. So this would be for things like injections that you receive in the doctor's office or certain oral cancer drugs. For more comprehensive prescription drug coverage, you need to look at Medicare Part D or Medicare Advantage, also known as Medicare Part C. Medicare Part B also covers clinical research studies. Now, like Medicare Part A, Medicare Part B will cover roughly 80% of the costs, leaving you with 20%. Unlike Medicare Part A, there are monthly premiums associated with Medicare Part B, which a lot of people don't know. These monthly premiums are based upon your income. Now, something else very important to take note of is that many people choose to defer Medicare Part B if they're still working past 65 and receiving insurance through their employer. And that's a great idea. However, you need to make sure that you do it in the proper way, follow the proper channels, because if you enroll outside of your individual enrollment period or a special enrollment period if you're qualified, you may be subject to a late penalty. So if you're considering deferring Medicare Part B, we highly encourage you to contact a broker in advance and make sure you're following the proper channels. You don't want to be spending money for no reason. Now, how do you know if you're eligible for Medicare? Most people approach retirement knowing that they're going to enroll in Medicare. You are eligible if you are over 65 and a U.S. citizen, or over 65 and a U.S. legal permanent resident who's lived here at least 5 years. You're also eligible if you're receiving Social Security benefits or railroad retirement benefits, or if you are eligible for these benefits, meaning you've worked at least 40 quarters, even if you're not receiving them just yet. You're also eligible if you are over 65 and you or your spouse is a government employee who has not paid into Social Security, but who has paid into Medicare payroll taxes while working, meaning a Medicare covered job. You may also be eligible for Medicare Parts A and B if you're under 65. If you're under 65, you'll be eligible for Medicare if you've received disability benefits for at least these 24 months do not need to be consecutive. There can be breaks in between, but it's got to be at least 24 months. You're also eligible if you have ALS or end-stage renal disease. As I said earlier, for most people, Medicare Part A comes with no monthly premiums. However, if you don't meet certain criteria, such as the 40 quarters, you can pay into Medicare. For 2020, the max monthly premiums are $458. Now, it could be less dependent upon your specific circumstances. If you're still working though, once you've reached that 40 quarters, the monthly premiums disappear. For Medicare Part B, as I said earlier, the monthly premiums are dependent upon your income. Medicare Parts A and B really does offer excellent coverage. There are a few gaps though that you want to be aware of. Medicare Parts A and B do not cover co-insurance, co-pays, or deductibles. Those are things that you want to look into a Medicare supplement plan or of course Medicare Advantage. Medicare Parts A and B do not cover prescriptions with the exception of those very, very limited prescriptions that we just talked about. Now for that you're going to want to look at Medicare Part D or Medicare Advantage. Medicare Advantage is the only other option other than Medicare Part D for prescription drug coverage. Medicare Parts A and B also do not cover dental, vision, hearing, or long-term care. So if this is something that you're interested in, you need to look into other options. Now, how do you enroll in Medicare Parts A and B? Well, the good news is that for many, if not most people, the process is automatic, meaning you don't have to do anything. If you're receiving Social Security benefits or railroad retirement benefits, you'll receive your Medicare card 3 months before your 65th birthday. And if you'd like to keep Medicare Parts A and B, that's it, no further action required. If you're choosing to defer Medicare Part B, however, it's very important that you follow the instructions on the back of the card and send it back. Because if you keep the card, you keep Medicare Part B and you will be charged for it. Now, once it's time to re-enroll, it's very important that you do so within 8 months of the termination of your health insurance. If you miss that 8-month mark, you may be charged a late penalty. And it's not a one-time late penalty. It's going to be tacked onto your monthly premiums forever. If you're not automatically enrolled in Medicare, you can take a look at medicare.gov, that's medicare.gov, and contact your Social Security office. Also, if you're a resident of Puerto Rico, you will be automatically enrolled in Medicare Part A, but you will not be automatically enrolled in Medicare Part B. To do so, you're going to need the form that I'm going to link below, that's CMS-40B. Anyone looking to enroll in Medicare Part B needs that form. Thank you so much for watching today's video. I hope it's been helpful and helped you to understand a little bit more about Medicare Parts A and B. If you have any questions, you can reach us at 888-410-0344. As I said, we are licensed health brokers, which means we work for you, not the insurance company. And of course, there is no charge for our services. I know nothing in life is free, but this really is. If there are any other videos you'd like to see, let us know in the comments below or just say hi. We'd love to hear from you. Make sure to click like and subscribe to stay up to date on all things Medicare, and we will see you next time. Thank you so much and have a great day.